Welcome to Health Fact versus Fiction, brought to you by HCA Healthcare UK. I'm Anna Richardson, and this is the podcast where we uncover the truths and bust the myths about your health with some of the country's leading consultants. Now, believe it or not, 1 in 4 of us here in the UK will have to deal with an allergy at some point in our lives. In one of our earlier episodes, I talked about my eczema and my asthma and various other problems I've got. And next door in the control room, we've got a combination of people allergic to dog and cat hair, certain types of food, and of course, pollen. So as a team, we are a total mess. And if you or a loved one suffers too, then you'll know just how much of a problem allergies can be. So in this episode, we're talking everything from eczema to anaphylaxis and how to spot and treat allergies in both childhood and adulthood. With me throughout is Dr Helen Brough, a consultant in paediatric allergy who works at HCA Healthcare UK's The Portland Hospital. Helen, welcome to the show. Now, I'm really interested in this episode because I had anaphylactic shock a few years ago after ingesting lupin, so I'm going to bore you to tears about this shortly. But first of all, we always start the podcast by busting some myths. Are you ready? It's like an exam. Mm-hmm. Can you tell me, please, whether the following statements are health fact or health fiction? Number 1, hay fever is a fever caused by hay. Fact or fiction?
So, your first statement is fiction. The reason why hay fever is called hay fever is because people used to get symptoms of a runny nose or itchy eyes or a cough or itchy skin around the hay harvesting season. So it was back in 1819 that they first described hay fever. They also described hay asthma, actually, because of similar things where they had coughing and wheezing around the time of the hay harvesting season. But it actually has nothing to do with hay. It has to do with pollens in the air. And the fever is actually a misnomer, because if you have a fever at the same time of having these other symptoms, it's more likely that you have a viral infection than having actual pollen allergy.
Thank you very much for a very thorough answer there. Tick. Number 2, you are at serious risk of death if you have a nut allergy. Fact or fiction?
So this is fiction. But I think it's important to talk about this because obviously people with a peanut allergy do need to make sure they avoid peanut, and they are at risk of anaphylaxis, which is a severe life-threatening reaction.
Which we will come on to later on. But no, if you have a nut or a peanut allergy, then you're not going to die, but you could have a severe reaction.
If you have a peanut allergy, we know that there's about an 11% chance or 12% chance that you're going to react within the last year to peanut. So the rate of accidental exposure to peanut is about 12%. And of those reactions, between 1/3 and 2/3 of people will end up having anaphylaxis if they eat peanut by mistake.
Which can be life-threatening.
Which can be life-threatening, but what we've also looked into is the rate of death due to anaphylaxis in people who have peanut allergy, and actually that is very, very low. So if you were to follow up 1 million people with peanut allergy, 2 of those people would die from their peanut allergy.
So thankfully it's a very, very low risk.
Yes.
Phew. Okay, number 3. If you had eczema as a child, then you're more susceptible to getting hay fever or asthma later in life. Fact or fiction?
That is fact.
Really?
Mm-hmm.
How come?
The reason why you are more likely to develop all allergies after you have eczema as a child is because we believe that you can become allergic through the skin. So actually having an inflamed, red, angry skin where you're exposed to foods or pollens in the environment can actually lead to you developing an allergy to those different allergens. And if you have eczema as a child, then your risk of asthma and hay fever actually doubles.